The skeleton consists of bones and cartilages. There are 206 bones in adults and more than 300 joints. The adult skeleton weighs about 10 kilos, but it is stronger than reinforced concrete. It gives shape or form to the body, allows movements, provides support, protects internal organs, produces blood cells, and acts as a reservoir for minerals like calcium. 90% of body's calcium is stored in bones. In this video, I'll describe the subdivisions of the skeleton into axial and appendicular, general features of bones, and salient features of various bones. The axial skeleton is situated in the midline. This is also called the primary skeleton. It consists of the skull, the vertebral column, ribs, and sternum. The word appendicular is derived from appendage. Since the limbs develop as outgrowths or appendages, it is called appendicular skeleton. Its constituents are the bones of the upper limb, including the shoulder girdle, and the bones of the lower limb, including the pelvic girdle. The individual bones are classified based on their size, shape, and location. Long bones are in the limbs and have a medullary cavity. The metacarpals, metatarsals, and phalanges are also included in this group. Short bones are the 8 carpals and 7 metacarpals. Flat bones are scapulae and skull bones. Sesamoid bones are contained within the tendons of muscles. The patella or kneecap is the largest sesamoid bone. Accessory or additional bones are seen sometimes. An example is the sutural bone generally seen in the lambdoid suture of the skull. The vertebrae belong to the irregular bones that do not fit the previous criteria. Now, some general features of bones. A tubercle or tuberosity is a rounded projection as on the humerus. A trochanter is a large rounded projection on the femur. A process is a large projection as on the scapula. A spinous process is a pointy or elongated projection as on the vertebra. A long elevation is crest when wide as on the hip bone. A long elevation when narrow is called a line as on the femur. Articular surfaces of bones are covered with cartilage. These are called facets when small and condyles when knuckle-shaped. Trochlea is like a pulley and is seen on the distal end of the humerus. Head or caput is the proximal expanded part of long bones. A fossa is a ditch or depression as seen on the temporal bone. A sulcus is a long groove or furrow as the bicipital groove on the humerus. A notch is an indentation as the scapular notch. A foramen is a hole or perforation in a bone or membrane and is usually for nerves or vessels. A canal is a duct or tube with both ends open as the carotid canal in the temporal bone. A meatus is a tube with one end closed as the external auditory meatus. The scapula is a flat triangular bone with 3 processes and 3 fossae. It overlaps the 2nd to the 7th ribs. Looking at the dorsal surface of the scapula, note the scapular spine. This shelf-like projection results in 2 fossae. Can you name the one above the spine? That is supraspinous fossa. And by the same token, the one below the shelf or the spine, this is the infraspinous fossa. These fossae are filled with muscles of similar names. At the lateral end of the spine is the acromion process. It is easily palpable. The coracoid process is curved. It is covered by muscles, but the tip is palpable. The thin superior border has the suprascapular notch. The medial border is almost straight and the lower 2/3 is palpable. The lateral border is thick and extends to the shallow glenoid cavity. Note the infraglenoid tubercle, which is larger as compared to the supraglenoid tubercle, which is smaller. The ventral or anterior surface is in close proximity to the ribs, and hence it is also called the costal surface. This saucer-shaped depression is the subscapular fossa. Can you name the muscle that fills this fossa? The clavicle is an S-shaped bone that is wholly subcutaneous and provides the only bony connection between the upper limb and the axial skeleton. It has a wider sternal end which articulates with the manubrium. Strong ligaments attach the inferior surface of the clavicle to the coracoid process of the scapula. It is the most commonly fractured bone in the body. The proximal end of the humerus has the head, the lesser and the greater tubercles, and in between the intertubercular groove. Between the head and the shaft is the neck, which is the common site for fractures. The distal end has 2 condyles. The medial is like a pulley and is the trochlea. The lateral is the capitulum. This projection here is the medial epicondyle. Also note the olecranon fossa at the distal end of the humerus. The proximal part of the ulna has this hood-like olecranon process that fits in the olecranon fossa of the humerus, while the distal part has a nib-like styloid process. The proximal part of the radius has the head and this tuberosity, also called the radial tuberosity or the bicipital tuberosity. The distal end is wider and has the radial styloid. The 8 carpal bones are arranged in 2 rows. In the proximal row are the scaphoid, the boat-shaped bone, which is the most commonly fractured carpal bone, especially when falls on an outstretched hand. Lunate, which looks like a half moon. The third one, the name is hard to remember, so you try, and if you don't get it, you quit. So it's called triquetral. And the fourth bone, the most medial one, is P-shaped and is called the pisiform. In the distal row are the trapezium, for thumb, and it has a groove here for a tendon. Next to that is the trapezoid, which is a triangular bone. This is the capitate, which is the largest of the carpal bones, and the medial most is the hamate with this projection, which is called the hook of the hamate. The metacarpals are long bones. The distal part is the rounded head which forms the knuckles. How many bones do you have in one hand? Here you can count them. These are the carpals, the metacarpals, and the phalanges. There are 14 phalanges, 3 in each finger and 2 in the thumb. The hip bone is a large irregular bone which joins with its fellow in front to form the pelvic girdle. This depression is the acetabulum, while this foramen or opening is the obturator foramen. Hip bone has 3 parts: pubis in front, ilium above, and ischium below. In children, these 3 parts are connected by cartilage. The femur is the largest bone in the human body. It has a large head, a neck, and 2 trochanters, a greater trochanter and a lesser trochanter. Connecting the 2 trochanters posteriorly is the intertrochanteric crest, while connecting the 2 anteriorly is the intertrochanteric line. On the posterior surface of the shaft is a long ridge, the linea aspera. At the distal end are 2 massive condyles, lateral and medial. The tibia is the medial of the 2 bones in the leg. The proximal end has the condyles for articulation with the femur and the tibial tuberosity for attachment of the quadriceps tendon. The medial surface of the shaft is subcutaneous. The distal end of the tibia is expanded. This projection is the medial malleolus. The slender fibula is not involved in weight transmission. At the proximal part is the head. Around the neck, the common fibular nerve, also called the common peroneal nerve, can be rolled. The distal end forms the lateral malleolus. Connecting the tibia and the fibula is the interosseous membrane. Notice the 2 malleoli. Which malleolus ends proximally? The tarsals are much larger as compared to the carpals. This is to support and distribute the weight. The 7 tarsal bones occupy the proximal half of the foot. The talus is the link between the foot and the leg. There are no muscles attached to this bone. Most of its surfaces are covered with articular cartilages. Talar fractures may result in avascular necrosis and non-union. The calcaneus or heel bone is the largest tarsal bone. On its medial surface is this shelf-like projection called the sustentaculum tali, as it supports the talus. It can be felt distal to the medial malleolus. The navicular is located between the talus and the cuneiforms. This projection, the tuberosity, is for attachment of the tibialis posterior. The cuboid is distal to the calcaneus and proximal to the fourth and fifth metatarsals. On its plantar surface is this groove for the tendon of peroneus longus. The three cuneiform bones articulate with the navicular proximally and the first three metatarsals distally. Of the three, the medial is the largest and intermediate the smallest. What would you call this cuneiform? There are 7 cervical vertebrae. Each cervical vertebra has a foramen in the transverse process. What is it for? There are 12 thoracic vertebrae and 12 pairs of ribs. Each vertebral body gives attachment to at least one rib. Here you can see an articular facet for the head of a rib. The lumbar vertebrae are 5 in number. Their distinguishing features are a large body, there's no costal facet on the body, and no foramen in the transverse processes. The sacrum is formed by the 5 sacral vertebrae. Their bodies are generally fused by the 20th year. This, by the way, represents the disc situated between the 5th lumbar and sacrum. Can you identify these vertebrae? Which one of these is a cervical vertebra? Which of these two is a thoracic vertebra? Name the bones that do not belong to the axial skeleton.